Good day, doctors. I'm lovely Keziah FLORES, an ophthalmology clerk for the month of April 2020, and I'm tasked to report on central microbial bacterial keratitis. The outline consists of the following: introduction, signs and symptoms, diagnostics, and treatment. Introduction. The cornea is a water-like structure that acts as the window of the eye. It consists of 5 layers, namely the epithelium, Bowman's layer, stroma, Descemet's membrane, and endothelium. Apparently, the cornea is not spared from diseases, and one of which is keratitis. Keratitis pertains to the inflammation of the cornea, and in bacterial keratitis, this is central in location, meaning it does not traverse the limbus. This may or may not be accompanied by a hypopyon. The hypopyon is usually sterile in bacterial corneal ulcers unless there is a break in the Descemet's membrane, the layer responsible for the structural integrity of the cornea. Common bacteria associated with keratitis include Neisseria, Corynebacterium, Shigella, Haemophilus, Listeria, and Pseudomonas. Risk factors for acquiring this disease include trauma or surgery, contact lens wear, epithelial ulceration, dry eye, and lid abnormality. Signs and symptoms. Patients with bacterial keratitis often complain of eye discharge and redness, eye pain, and photophobia. Usually upon examination, there would be noticeable purulent eye discharge, epithelial defect, and anterior chamber inflammation and/or hypopyon. Diagnostics. Diagnostics that can be done include the following. First would be gram stain and culture of corneal scrapings. This would help in arriving at a targeted treatment because it would reveal the bacteria involved. Second is slit lamp examination. This can be done to check for foreign bodies that may be causing the said condition. Third is fluorescence staining. Fluorescence stain can be done at the outpatient department for detecting epithelial defects. Please refer to the picture. Epithelial defects would stain green upon application of the said stain. Cobalt blue light filter is used. How to treat someone with this disease? We focus our attention on the first 72 hours of the occurrence of this condition. We usually advise the patient to be admitted for him or her to be examined daily, if possible with a slit lamp. This is advantageous because it would help in determining the response to the treatment and in adjusting the frequency of the antibiotics. The frequency of antibiotic administration may be tapered down if with symptomatic improvement and when the ulcer shows signs of improvement such as decrease in lid edema, reduced chemosis and bulbar conjunctival injection, reduced density of infiltrates and area of epithelial defect, and reduced haziness of the perimeter of ulcer and of the stromal infiltrate fibrin, and the level of hypopyon dilatation of the pupil. If there is significant improvement, frequency of antibiotic application may be reduced from every hour to every 2 hours, then every 4 hours over the next 2 weeks. Longer courses may be needed in more severe cases. Fossey and colleagues in the year 2018 stated that topical antibiotics are used in treating bacterial keratitis. Topical antibiotics include the following: cefazolin 5% and gentamicin 1.4% eye drops applied hourly for 2 days, or ciprofloxacin or ofloxacin eye drops hourly for 2 days. Cefazolin is a first-generation cephalosporin known to have an activity against pneumococci, streptococci, and staphylococci. Gentamicin is an aminoglycoside and is usually used against gram-negative and gram-positive bacteria. On the other hand, ciprofloxacin and ofloxacin are fluoroquinolones and are known to be effective against Pseudomonas and Neisseria. An available brand of ciprofloxacin in the Philippine setting is Celsus, which would cost around 210.50 Philippine pesos. Adjunctive treatment can also be given. These include the following: atropine, which would help in dilating the pupils and preventing synechiae to lessen the pain. Oral analgesics, which would also help in minimizing the pain. Anti-glaucoma medications if with high intraocular pressure. And vitamin A, which may, emphasizing on the word may, which may be helpful, especially in countries where vitamin A deficiency is prevalent. These are my references for my report. This is the end of my report. Have a good day.